People died in England and Wales last year than at any time since 2003, which means that life expectancy for both men and women actually went down rather than up. Over 28,000 more people lost their lives than the year before. Public Health England says flu killed many older people, but some experts believe cutbacks in care for the elderly are also to blame. Sky's senior correspondent David Bowden reports.
For decades, generations of us have grown up safe in the knowledge that we were all living longer. But new figures suggest that trend might be slowing down or even slipping into reverse. In England and Wales last year, the number of deaths hit a 12-year high, resulting in life expectancy coming down for both men and women. But Professor John Newton from Public Health England says it's not surprising, and small changes in mortality rates are to be expected as we all get older.
We've seen really profound increases in life expectancy, about 5 years in the last 20 years. Now, it is possible that that is now starting to come to an end, and we won't see quite such big increases in the future. So the effect of the ageing population is now balancing out the effect of improving mortality rates, so that the numbers of deaths may start to be, I think, more unstable from year to year. So, for example, this year, in 15-16, there's no such increase in deaths. So we are expecting the number of deaths to go down again this year.
The spike in deaths in the early months of 2015 coincided with a flu outbreak and a vaccine that was less effective than in previous years. But some experts believe that cuts to funding for elderly care is leaving old people vulnerable.
I think it's very likely that flu has played some role, but we've been concerned that there may be other things going on. We've been looking at what happened in earlier years where we have the data from. When we looked in a little bit more detail, we were able to show that the increase in mortality was highest in those local authorities that had been affected most by some measures of austerity.
There is, though, something we can do to keep ourselves going a bit longer, according to those who study the effects of ageing. Don't give up work too soon.
In terms of keeping ourselves healthy in old age, we know that there's a big use it or lose it issue. Keeping mentally active and keeping physically active is extremely important. Physical activity is the one thing we know really works in terms of preventing ill health in old age. The challenge is we don't know how to get people to do it.
For most of us, the days of living 70 years and 10 are long behind us. Men in England and Wales can now expect to live beyond 79 and women to just short of 83. David Bowden, Sky News.
This is Sky News Tonight. Coming up.